Good morning. Everyone ready? Sure. Yep. Good morning, Queensland. We've just finished our daily COVID briefing with the Premier, and we can advise Queenslanders that we have 9 new confirmed cases, all of which were detected in the community with known links to the Indooroopilly cluster. That brings to 18 the number of genomically linked cases in that cluster. They are, of course, all the Delta strain. This is the most number of new community cases, new community infections we've reported in Queensland in almost 12 months. The last time we were at this level was August 22. Of the new cases, 4 are linked to a karate school attended by one of the cases that we reported yesterday. That karate school is held at Ironside State School, but it is attended by children from other schools and their parents. One of the new cases from the karate school is a student from Brisbane Boys Grammar. There is one case which is a household contact, the father of the student at Brisbane Boys Grammar. There are 2 cases linked to Indooroopilly State High School and 2 cases linked to Ironside State School. That brings our total number of cases to 1,809, 53 are active. We did 11,468 tests in the last 24-hour period. And our message is simple: that is not enough tests. We need more Queenslanders, particularly in the southeast, to get tested. While that's a high number, a high turnout for a Saturday, in previous outbreaks that were not this serious, we were consistently testing more than twice that number. More than 20,000 in each day. We have lots of testing locations available right throughout the southeast. It's particularly important on the Sunshine Coast, where the Chief Health Officer is concerned that there may be missing links between the cases that we are aware of. So we'd urge the media, everyone who's on social media right now, to do what they can to get out that message that we need to see more testing, particularly today, tomorrow, Tuesday, to give us the kind of confidence we'll need to make decisions around how long this lockdown should proceed. There are now thousands of Queenslanders subject to home quarantine directions, including those who have been at 5 schools that are considered exposure sites: Indooroopilly State High School, Ironside State School, St Peter's, Brisbane Grammar School and Brisbane Girls Grammar School, including those who attended an open day at Brisbane Girls Grammar School. The advice to students and families will vary depending on the risks, the exposure risks at that school, and so we would urge everyone who has been at those schools to heed the advice that the schools are providing to their school communities and the advice being provided by the public health units. They are working as quickly as they can to get those directions to people so that they know exactly how they apply to their households. Throughout yesterday and last night, the NRL worked closely with Queensland Health to develop strict new arrangements to allow for some games to proceed today at one venue with no spectators. It is only possible because the players and officials have been in a bubble for some time. The measures in place are the strictest that have ever been applied and have been assessed according to the public health risks. Also yesterday, we welcomed the declaration from the Commonwealth Government that these 11 LGAs are now considered national hotspots. That means that Queenslanders in those 11 LGAs will be eligible to apply for financial support. Queenslanders who lose more than 20 hours work in a week will be eligible for $750 payment per week, and those who lose under 20 hours work will be eligible for $450. We are advised that the application form will be available by the 7th of August. The Prime Minister and the Premier discussed this yesterday, and we welcome the support of the Commonwealth as we endeavour to get in control of this new Delta outbreak.
So 9 new cases acquired in the community in Queensland over the last 24 hours. So we can see that these case numbers are, as to be expected with the Delta variant, rapidly escalating. So thank you to everyone who's been staying at home since that stay-at-home order was put in place at 4 p.m. yesterday. This morning when I came in, there were very, very few people out there, and the people who were wearing a mask. So thank you very much for that. We all need to work together for the next 3 days if we're going to be able to lift that stay-at-home requirement. It is vital. Anyone with any symptoms at all, it doesn't matter where you are, because I don't know where this virus is at the moment. Please come forward, because then we'll be able to find those other chains of transmission which I suspect are out there. And in the Sunshine Coast, please, it is particularly important that you come forward, because I suspect that's where this outbreak started and then has reached a critical level where it started to escalate. And we've picked up at the escalation point, but I still think there will be cases there in the Sunshine Coast that we don't know about. And if we don't find them, they will continue to spread. So that is really critical. I do not have any link between these cases that have happened in Indooroopilly and where it originally started from those 2 people who came into Queensland from overseas with the same genome sequence. So this is critical. Now, please, everyone, just stay at home. If you can, stay at home the next 3 days. Now, one thing I do need to clarify is there is a lot of confusion out there, and I can understand this, so I'm going to try and clarify it. There is a lot of confusion about staying at home as part of this broad requirement for the 11 LGAs and being in quarantine. If you are asked to go into quarantine, if you get a phone call and you're told you're now in quarantine, that means you cannot leave your home except to go and get a test. And you will be told to go and get that test. And of course, if you get symptoms at any stage while you're in quarantine, go and get a test. But other than that, there are very, very limited reasons you can leave your home, because you are very high risk. We need you to be at home. So therefore, if we've got everyone that we can find that's at risk, then there's that possibility that we'll be able to remove those stay-at-home orders for everyone else in 3 days' time. So I just reiterate, if you're asked to quarantine, that is different to what we're saying to the general community. You cannot leave for exercise. You cannot leave to go and buy groceries. If you need groceries or medications, ring 134 COVID and someone will bring them to you. If you're in quarantine, that is exactly that. You are in quarantine. Now, the 5 schools that we've identified here in Brisbane that are a risk, there are different arrangements, and I apologise for this, there are different arrangements for each school depending on the risk. So for some of the schools, the child and their parents and their whole household has to be in quarantine. For others, it's only the children. So please, for those 5 schools, make sure that you understand from the school, and the schools have been fantastic sending out information, what you need to do, and follow it. If you are being told that the whole household is in quarantine, that is exactly that. The whole household is in quarantine. Now, I realise all this is confusing, but we just have to work through it as best as we can. Always go on our website or ring and get advice if you don't know what to do. Or please, if you don't know what to do, take the most cautious response, which is just to stay at home until you find out what you should be doing. We've got a lot to get through in the next 3 days if we're going to be able to remove these requirements to stay at home. We know it's the Delta variant. We know it can transmit within seconds of exposure, and we know it can transmit within 30 hours. So someone can be exposed and 30 hours later they can infect someone else. So that's why we have to take these really, really strong response, these strong arrangements, if we're going to manage it. Thank you.
So, as the Deputy Premier said, it has been 12 months since we had at least 9 cases in the community recorded in a single 24-hour period. But this time, we're dealing with a virus that spreads in hours, not days. So we must be vigilant. Our testing numbers are not high enough. Yesterday, I talked about the number of cases New South Wales has, over 3,000 in 6 weeks. What I'm more concerned about is the number 14. New South Wales has recorded on average 1 death every 3 days from this virus. 1 death every 3 days. So we cannot be complacent. We want more people coming out and testing. We will be putting out on many social media platforms today where you can find testing sites in your local area. For example, around Indooroopilly, we have the Tooringa car collection site open from 8 to 4 today. We have the Marta, South Brisbane Collection Centre open from 8 to 4 today. The 4-site Highgate Hill site, we have Sullivan and Nicolaides at Annalee open to 11:30 today. We have the RBWH open until 9 p.m. today. We have Sullivan and Nicolaides at Bowen Hills. It's got a COVID car collect site from 11 to 2 today. Importantly, Sunshine Coast, we have the Minor Injuries and Illness Centre clinic at Caloundra, the Caloundra Specialist Ambulatory Care. It's open from 8 a.m. to 8 p.m. You need to call before booking there, but please, we want people coming out and getting tested. The 4-site Maroochydore, 7:30 to 5. The 4-site at Budrum, 7:30 to 5. Nambour General Hospital, 8 to 4 today. Currumbin COVID Clinic, 8 to 4. And 4-site Moffat Beach COVID Clinic, 8 to 2. This is just some of the sites. We will monitor our sites again today. And if need be, we will look at standing up additional sites and potential drive-through sites, depending on where the most demand is. We ask people to be patient. We know you are likely to wait, whether it's a walk-in or a drive-in clinic. Remember to wear your mask, especially if you're lining up at any of these testing clinics. But it doesn't matter where you are in Brisbane or anywhere in Queensland. If you have any symptoms whatsoever, you must come forward and you must get tested. I also need to report that I will be writing to the clerk of the Queensland Legislative Assembly today. I've spoken to the Speaker this morning, and I will be writing to propose a change to our estimates hearings. Already we know Tuesday and Wednesday next week cannot go ahead because those members who otherwise would have travelled from the regions to attend the estimates hearing on Wednesday, if the lockdown does lift on Tuesday afternoon, would have had to travel on Tuesday, which would be in breach of the directives to travel into the lockdown area. So we will be rescheduling those 3 days of hearing to the following week. So they will now be on Tuesday, Thursday and Friday, acknowledging that there is an Echo Show Day on the Wednesday. So that is the Transport and Resources Committee will be Tuesday the 10th of August, the Legal Affairs and Safety Committee will be on Thursday the 12th of August, and Community Support and Services on Friday the 13th of August. And I've notified the opposition, the Manager of Opposition Business this morning as well, of this change. We hope this means that it can go ahead, but of course there may be changes to restrictions if the lockdowns lifted, and we will need to manage those changes as well. So I thank everyone for their patience. Again, please only leave your home to get tested or essential services over the next couple of days for the lockdown. And for those who are being asked to quarantine at home, it is a lawful direction. You must stay at home and only leave home to get a test if you are unwell or need any support whatsoever. You ring 134 COVID. Thank you.
I will thank the vast majority of people that are impacted by the current lockdown for their cooperation and what they've been doing to make sure that they do comply with our Chief Health Officer's directions. However, I do have to note that there has been a small percentage of people that are still doing the wrong thing, and it's quite disappointing to say that in the period since we implemented the new restrictions, we've had to issue 28 penalty infringement notices and arrest 4 persons for breaches of those directions. For instance, we handed out 43 masks yesterday and gave one person a penalty infringement notice for not complying when given the opportunity. Specifically in relation to the lockdown, we did 123 vehicle intercepts. 11 persons were issued with penalty infringement notices for breaches in that period. One further person on foot for not complying with the directions, and that for all of those 12 people it means that they were out in the community when they did not have a valid reason to do so. We received 80 calls for service from our community around private residence activities, and of those ones that we visited, 11 were issued with penalty infringement notices for having private gatherings against the directions, and a further 4 were arrested, which is terribly disappointing to think that people, when our officers come around, do give them the opportunity to comply, and they chose not to. We had 2 further border breaches, people attempting to enter Queensland when they shouldn't, and 3 persons who failed to follow directions from our health officers when they were intercepting with them. Look, we did have some protest activity yesterday. It was minor. We are monitoring that situation. The message is the same as yesterday. I will repeat it. Now is not the time to protest. You can protest lawfully in this state. We have a long history of allowing people to have lawful protests and go about their business in doing so, but now is not the time, and we will take a very strict stance on that if anyone chooses to do so. Thank you.
No, we're not. So I have the whole genome sequence. It shows that that 17-year-old who attends Indooroopilly State High has exactly the same whole genome sequence as 2 people who arrived into Brisbane from overseas. One from Indonesia, who I suspect gave it to the person who came from the UK, either at Singapore Airport, on the plane travelling from Singapore to Brisbane, or in hotel quarantine. I don't know which of those 3 places was the transmission event. But I don't have the intermediaries between those 2 cases and that 17-year-old student. I think it's most likely that it's gone from the person who was managed up at Sunshine Coast. They were discharged from the Sunshine Coast University Hospital on the 17th of July. All the protocols put in place by CDNA, the Communicable Diseases Network of Australia, were thoroughly followed, but we know with Delta that it can be more infectious, so we're just looking whether that has led to the transmission. This is why I'm asking that anyone in the Sunshine Coast who is unwell with any symptoms at all to immediately come forward. We have tested all of the people who live in the same household as that gentleman who came from the UK, who has the same whole genome sequence. They are all negative, and we are now doing serology to see whether any of them were infected and have recovered, to see if that might be the link. But at this point in time, please, anyone in the Sunshine Coast, so that we can see whether there has been transmission there, please come forward.
Where would you like to see the testing numbers?
Oh, New South Wales is doing 100,000 a day. Let's see how we can go. So, of course, we wouldn't aim for 100,000 a day. Their population is nearly double ours, but I would like to see numbers around that 40,000 level, which is what we've seen in the past.
And you said there was some confusion with the quarantine rules. Have people been leaving quarantine when they shouldn't?
No, this is what is so fantastic. People are just unsure, so they're erring on the side of caution. And then asking can they or can't they. So it is brilliant. The response by people has been first class. It really has. So we're just working through with people, because if there are people who are confused but doing absolutely the right thing, I just want to make sure that there are other people who might be confused and not err on that side of caution. So that's why I'm saying, if you're not sure what you're meant to be doing, just check. So those 5 schools, it is confusing. Each school has a different regimen in place because the risk is different for each school. So if you're involved with one of those 5 schools, please just check. If you've got a quarantine notice, you can just read the quarantine notice. It will be very clear. But if one hasn't been able to be given to you yet, so you've just had a phone call, just check what you need to do.
Why does the NRL need to go ahead and lock in that way until next weekend?
And perhaps that's a question you should ask them. So from my point of view, I made the decision that based on the plans they had in place, that they could not go ahead, and they immediately cancelled all of their games yesterday, although the lockdown only came into force at 4 o'clock. Then they went and thoroughly reviewed their plans, put in a lot of additional mitigating factors, and represented those new plans to me. So these are different plans to the ones that they were working under last year. This is a different virus. I reviewed those new plans, and I am confident that with those new arrangements that this is of minimal risk. So I've allowed them to go ahead without any spectators and minimal numbers of support staff. I do have that authority under the Public Health Act. Yes, I can make those decisions. But after 4 p.m. So it was an NRL decision to cancel the games prior to 4 p.m, which was excellent on their part. They understood the message, they understood the risk, so they cancelled the games, and then they came back to me and said, if we do all of these additional things, would you support us going ahead without spectators? That is absolutely the case. No one in Queensland had prior knowledge, and I thank every single Queenslander who listens to these press conferences and gets the information and acts so fast. The NRL is no different. I didn't let the Ekka know what I was doing. I didn't let the AFL. I didn't let the basketball, because I was flat out working out what I should be doing for all of Queensland. So the NRL, I understand, is an important sport here in Queensland. But I'm sorry, I just didn't have time to go and talk to all of these people individually. I talked to them through these press conferences.
When it comes to lifting the lockdown, is there a number of cases we need to be under for you to make that decision? Is that a threshold you're working on?
The threshold is that I am confident that all of the cases that potentially have been exposed are safely in quarantine and are unlikely to end up having been infectious out in the community, so unlikely to have been out there spreading. So the purpose of the lockdown is to stop the virus spreading. So it is to have everyone in their homes. So as we find people, we find them in their homes, and they'll have had minimal exposure out in the community. They might have gone to buy some food, they might have gone for a walk with a mask on around in their immediate community, but they haven't been to restaurants, to karate classes, to the gym, etc. That's why we need the lockdown. No, she wasn't. No, she was down to get a dose, so she had a booking, but she hadn't actually had it yet.
Just on the vaccines, are we going to be getting more vaccines? Professor Michael Kidd mentioned yesterday he was going to offer up more vaccines to Queensland.
It hasn't happened so far. At this stage, we've had 18 cases linked to this outbreak. New South Wales has had over 3,000, so of course the Commonwealth is focused on New South Wales, and so they should be. We will of course keep a very, very close engagement with the Commonwealth. I meet every single day with the Chief Medical Officer and I keep him informed of where we're at, and then depending how things progress, then they would work with us to offer us more vaccine. There isn't more vaccine at the moment for them to offer.
Just in regards to exercise, can you define the rest of strenuous exercise? Because we're seeing plenty of people not wearing masks and literally just walking around, especially in the cold zones.
Right. Strenuous exercise is where you are huffing and puffing, and genuinely, if you were to have a mask on, it could harm your health. Walking around for the vast majority of people is not strenuous exercise. Perhaps if you're in your 90s and you are struggling, then that would probably be strenuous exercise. But for most people my age, it's not strenuous exercise. Of course I am. So I'm very, very grateful to the ECA that they made that decision after talking with me to delay setting up, because that would have brought people into Brisbane from outside the southeast corner and increased the risks for those people coming in who then would go out. So the ECA is working very, very closely with us.
Is this the first time it's been spreading through schools like this?
Yeah.
Is that a worry for you?
Yes.
I feel like we haven't seen that so far.
Yes, that's a very, very astute observation. I am concerned. I think it's masks. I genuinely think that masks have made a big difference. And I am worried that this is spreading in schools because, of course, they don't use masks. So we have introduced, when schools are back on Monday and Tuesday, for that very small number of children who are children of essential workers or vulnerable children, that all children in secondary school from year 7 onwards, doesn't matter their age, there might be some 11-year-olds there for instance, that they must wear masks, and all teachers for primary school and for high school, unless they're teaching children who are deaf, all teachers and staff must wear masks across the entire school spectrum.
Back on the NL.
I'm not sure. I've got some whole genome sequencing back that I really need to work through. Looking at the epidemiology, it would suggest that the medical student was the index case when I look at the timeframes when the other people became unwell. But there are some people in that family who haven't had symptoms. And if you don't have symptoms, it's really hard to work out when an illness started. So I'm not sure that the medical student is the absolute index case. We're just working that through. No. She's attended classes at Royal Brisbane Hospital and also at St Lucia at the medical school there, and at PA at the TRI.
Just back on the NRL, some people are saying it's double standards because it was a no yesterday. Then they sort of write to you and it seems like the rules then businesses don't get that chance to come to you and say, oh, if we do this, are we allowed to open?
Yeah.
I understand how that's frustrating for people.
Oh, it's very, very frustrating, and of course I sympathise. And the last thing I want to see is any business that's been closed and has got into financial difficulty. It is very, very difficult. But we have to manage this. Now, the difference with the NRL is that they've actually been in a bubble. I know there's been some breaches, which the NRL has taken very seriously each time, and they've assured me that they will manage their people so there aren't breaches, but they have been in a bubble for quite a while, so they're nowhere near the same risk as we see in other businesses who haven't been in bubbles. They've been dealing with the community face to face, day after day. So it is a totally different situation. I was not happy with the plans that were in place because they were based on a different variant, a different situation where we were last year. So I just said no. Then the NRL went and looked at those plans and looked at how they could increase the restrictions and manage them to make them much safer.
Dr. Young, we've heard about some people, the guests quarantining in South Bank, who've just been transferred out of it. Do you know anything
Yes,
about that?
I do. Thank you. So South Bank Ridges, after I think it's nearly 18 months, have decided that they want to go back to being a normal hotel. They have done an absolutely brilliant job. I was very, very sad when they told us that, but I can understand it. This is such hard work. It is extraordinarily hard work for the hotel management, for the staff, for all of their arrangements, and they want to go back to being a normal hotel. So we're working with them. They allowed us to keep putting people in there right to the last day because we've just had so many requirements put in place for needing hotels. So they worked with us, but now as we're coming to the end of the time that they're available, we will have to move guests to another hotel.
Sure. Look, we are prepared in case some people do intend to protest. What we do is we have an engagement approach with protesters and their organisers to try and talk them through it, and obviously in this instance trying to encourage them not to. So that will be ongoing. So I'm hopeful that we'll be able to work through that. We also have some intelligence that it may not be today, there may be protests tomorrow, so we're actually preparing for both days. So what we're doing, of course, is being cautious and making sure we've got sufficient police there to deal with it if we need to. Unfortunately, as I said, there was 80 calls for service, so thank you to the Queenslanders that have rung us up when they're concerned around the conduct of people in residences. I don't have the details for all of those. Wouldn't surprise me, but of course we'll put something out later to explain what all of those actions that we've taken were. Look, our police officers, wherever they are, will be undertaking checks of people to make sure that they're doing the right thing. For instance, I was on the Sunshine Coast this morning and there were two young officers there checking people that were in the area where I was that were getting coffees to make sure that they were doing the right thing. Now, our officers will do that very politely and work with people and make sure that they are doing the right thing, and I'm very happy to say everyone was doing the right thing there. But the point is, probably for convenience as much as anything, I do suggest people to carry ID, because if we're trying to check if someone's where they should be, it makes it a lot simpler for everybody if you can do that quickly. Yeah, what disappoints me is we give them the opportunity to comply. We've been absolutely consistent through this response that we take a compassion, communication and compliance approach. So we communicate with people, we get them to understand, we take on board their individual circumstances. If they're trying to do the right thing, well, that'll be fine. But if they want to do the wrong thing and push back, there's consequences, and we saw yesterday, unfortunately, we've had to take that sort of action. Thank you.
So we gave information to all the universities back on the 23rd of February saying that healthcare students were part of 1B and could get vaccinated. But I'll be honest with you, my priority was actually healthcare workers. It was more important to get as many of our healthcare workers vaccinated, and students came second. So she did have an appointment for a vaccine in the next week. She had that appointment made. She'd done her best to try and get vaccinated, but she just couldn't access a vaccine. So as a result of that, I have said that when we go into a restrictions arrangement, as we had most recently, that healthcare worker students who weren't vaccinated could not do clinical placements in vulnerable settings, hospitals, aged care, disability care. So they know they should be vaccinated, but they're struggling to get vaccine.
Did you have the number of people in quarantine from the school?
I've got quarantine numbers, but I don't think they're up to date because the numbers are much larger than this. So on our formal database this morning, we've got 5,869 people in total in quarantine, 1,877 are in home quarantine. But there's so much data going in that I suspect it's a lot higher than that.
Would you like to see students and teachers vaccinated given the outbreak we're seeing in the school?
New South Wales is aiming to vaccinate older students because the modelling shows that they're the group that actually then spread. At the moment, the data suggests that younger students, so 12 to 15, remembering that in Australia the TGA has only approved Pfizer vaccine down to age 12, not any younger than that. So the modelling suggests that vaccinating 12 to 15-year-olds doesn't give you a lot more protection. So eventually, yes, we will of course be vaccinating younger students down to age 12, but at this point in time it's more important to vaccinate older people.
Last question. So you've got 9 new cases today. Can you say that they're all in isolation? So you're not so concerned about this getting out from those 9 fresh cases?
Oh, no, they weren't all in isolation. No, sorry if I've given you that information. No, this is still very early and we've got to find all. So remember, once symptoms start, we go back 2 days and you're most infectious. In fact, out of your whole illness, it's those 2 days you're most infectious. So no, they wouldn't have all been in quarantine for that 2-day infectious period. The medical student did go into the Royal Brisbane and Women's Hospital, yes, so did have some contact in there. So that is a site, an exposure site that we're looking at the moment.
Thank you very much.
Thank you.